Allergic rhinitis, often called hay fever, is a common condition. It affects millions of people worldwide. This happens when your immune system overreacts to allergens in the air. These allergens include pollen, dust mites, mold, and pet dander. When you inhale these allergens, your body releases histamine and other chemicals. This leads to inflammation in the lining of your nose and sinuses. Rhinosinusitis, on the other hand, refers to inflammation of both the nasal cavity and the sinuses. It can be caused by various factors including viral, bacterial, or fungal infections as well as allergies. When rhinosinusitis is specifically triggered by an allergic reaction, it is known as allergic rhinosinusitis. This condition can be either acute or chronic. Acute allergic rhinosinusitis typically lasts for a short period, usually less than 4 weeks. It is often triggered by exposure to allergens like pollen or pet dander. Chronic allergic rhinosinusitis, on the other hand, persists for more than 12 weeks, even with treatment. Understanding the difference between allergic rhinitis and allergic rhinosinusitis is important for proper diagnosis and treatment. While allergic rhinitis primarily affects the nasal passages, allergic rhinosinusitis involves both the nose and sinuses. This distinction helps healthcare professionals tailor treatment plans to address the specific needs of each patient. Diagnosing allergic rhinosinusitis typically involves a combination of medical history review, physical examination, and sometimes additional tests. The doctor will start by asking about your symptoms, their duration, and any potential triggers you may have noticed. They will also inquire about your medical history, including any past allergies or respiratory problems. Next, the doctor will perform a physical examination. This may involve looking inside your nose using a special instrument called a nasal speculum. They will check for signs of inflammation, such as swelling, redness, or discharge. The doctor may also examine your ears, throat, and neck for any related symptoms. In some cases, further tests may be recommended to confirm the diagnosis or rule out other conditions. Allergy testing, for example, can help identify specific allergens that trigger your symptoms. This can be done through skin prick tests or blood tests. Imaging studies such as X-rays or CT scans are usually not necessary for diagnosing allergic rhinosinusitis. However, they may be used in certain situations to rule out other conditions or complications. By gathering information from your medical history, physical examination, and any necessary tests, the doctor can make an accurate diagnosis of allergic rhinosinusitis. This comprehensive approach ensures that you receive the most appropriate treatment plan tailored to your specific needs. Allergic rhinosinusitis presents with a range of symptoms that can significantly impact daily life. Recognizing these symptoms is crucial for seeking timely medical attention and receiving appropriate treatment. One of the hallmark symptoms is nasal congestion, often described as a stuffy or blocked nose. This occurs due to inflammation and swelling of the nasal passages, making it difficult to breathe through the nose. Another common symptom is a runny nose characterized by a clear, watery discharge. This is the body's natural response to allergens attempting to flush them out. Many individuals with allergic rhinosinusitis also experience sneezing fits, particularly upon exposure to allergens. This is the body's reflex to expel irritants from the nasal passages. Facial pain or pressure is another common complaint, often described as a dull ache or a feeling of fullness in the cheeks, forehead, or around the eyes. This is caused by inflammation and pressure buildup in the sinuses. Treating allergic rhinosinusitis typically involves a multi-pronged approach aimed at reducing inflammation, relieving symptoms, and managing the underlying allergic response. One of the primary treatment strategies is avoiding known allergens, which can be challenging but highly effective in reducing symptoms. This may involve identifying and minimizing exposure to common triggers like pollen, dust mites, mold, and pet dander. Medications play a crucial role in managing symptoms and controlling the allergic response. Nasal corticosteroids, available as nasal sprays, are often the first-line treatment. They work by reducing inflammation in the nasal passages, relieving congestion, and improving airflow. Antihistamines, available over-the-counter or by prescription, can help block the action of histamine, a chemical released by the body during an allergic reaction. They are particularly effective in relieving symptoms like sneezing, runny nose, and itching. Decongestants, available as oral medications or nasal sprays, can provide temporary relief from nasal congestion. However, oral decongestants can cause side effects like insomnia and increased blood pressure, while prolonged use of nasal decongestants can lead to rebound congestion. Medications play a crucial role in managing the symptoms of allergic rhinosinusitis and providing relief from discomfort. These medications work through various mechanisms to target different aspects of the allergic response and inflammation. Nasal corticosteroids are highly effective in reducing nasal inflammation and are often the first-line treatment for allergic rhinosinusitis. They are available as nasal sprays and work by blocking the inflammatory response in the nasal passages. Antihistamines are another important class of medications used to manage allergic symptoms. They work by blocking the action of histamine, a chemical released by the body during an allergic reaction. Histamine is responsible for many of the common symptoms of allergies, such as sneezing, runny nose, and itching. Decongestants can provide temporary relief from nasal congestion, but they do not address the underlying inflammation. They work by constricting blood vessels in the nasal passages, which reduces swelling and improves airflow. Leukotriene modifiers are a type of medication that blocks the action of leukotrienes, which are inflammatory chemicals that contribute to allergic symptoms. Immunotherapy, also known as allergy shots, is a long-term treatment option for allergic rhinosinusitis that aims to modify the body's immune response to allergens. This approach involves gradually increasing doses of allergens injected under the skin over a period of time. The goal of immunotherapy is to desensitize the immune system to specific allergens, reducing the severity and frequency of allergic reactions. As the body becomes accustomed to the allergens, it becomes less reactive, leading to fewer and milder symptoms over time. Immunotherapy is typically recommended for individuals with moderate to severe allergic rhinosinusitis who have not experienced satisfactory relief from other treatment options. It is a personalized treatment plan, with the specific allergens used for injections determined through allergy testing. While immunotherapy can be highly effective, it requires a significant commitment from the patient. Injections are typically given regularly for several years, and close monitoring by a healthcare professional is essential. Surgical interventions for allergic rhinosinusitis are typically reserved for cases where medical management has failed to provide adequate relief or when there are structural abnormalities contributing to the condition. These procedures aim to improve sinus drainage, remove blockages, and restore proper airflow. One common surgical procedure is endoscopic sinus surgery. This minimally invasive technique involves inserting a thin, flexible tube with a camera and surgical instruments through the nostrils into the sinuses. The surgeon can then visualize the area and remove any obstructions such as polyps or a deviated septum. Another surgical option is balloon sinuplasty. This procedure involves inserting a small balloon into the blocked sinus passage and inflating it. This widens the sinus opening, improving drainage and reducing pressure. In some cases, more extensive surgery may be required, such as septoplasty or turbinate reduction. Septoplasty corrects a deviated septum, which is a crooked or off-center wall separating the nasal passages. Turbinate reduction involves reducing the size of the turbinates, which are bony structures inside the nose that can become enlarged and obstruct airflow. While it may not be possible to completely prevent allergic rhinosinusitis, several measures can be taken to reduce exposure to allergens and minimize the frequency and severity of symptoms. One crucial step is identifying and avoiding triggers. This involves paying attention to patterns in symptoms and identifying potential allergens that worsen them. Common triggers include pollen, dust mites, mold, pet dander, and certain foods. Keeping indoor air clean is essential for reducing allergen exposure. Using high-efficiency particulate air filters in air conditioners and vacuum cleaners can trap allergens and prevent them from circulating in the air. Maintaining optimal humidity levels indoors can also help. Dust mites thrive in humid environments, so using a dehumidifier can help reduce their population. Regularly washing bedding, curtains, and other household fabrics in hot water can help remove dust mites and other allergens. When outdoors, wearing a mask during peak pollen seasons can provide some protection.